We're going to go ahead and get started with our 10 a.m. session. We'll start off with a video from our OTC Health and Wellness Clinic.
Hello, my name is Dr. Mark Chambers, and I'm one of the physicians here at Equality Healthcare OTC. My partners are Dr. Shelby Smith and Dr. Teresa Troy, and we are the board-certified family physicians here at the medical clinic at OTC. I wanted to take a minute to let you know about the services we offer here at the clinic, which is a benefit to you and your legal dependents as an employee here at OTC. We are a full-service family medicine clinic, and we offer acute and chronic care visits for things as simple as the viral infections or a cold to more complex issues such as diabetes and heart disease management. We also offer health maintenance exams with screening laboratory as part of your benefits here at OTC. You may already have a regular family doctor, but you may also utilize our services here as well. We can often coordinate care with them as needed. In addition, we are able to coordinate care through all of the local specialists if you happen to need a specialist care for acute or chronic problems. Our clinic is open Monday through Friday, 8 to noon, by appointment, and our phone number is 417-866-3133, and our clinic is located in Lincoln Hall here on the OTC campus. We're also on call throughout the week when we are not holding office hours. If you have an after-hours urgency, then you may call the office and be connected to one of our physicians if needed. If you have any questions about our services, feel free to call during office hours, and our receptionist, Karen Bradford, will be happy to help. We also have 2 nurses on staff to assist with your healthcare needs, Joanne Hosmer and Catherine Robertson.
I'd like to take this time to introduce Gordon Kinney, President of MedPay. They are our current broker for our benefits for the 2018 year.
Good morning, all. Hope you're doing fine. We're going to go through the booklet, or pamphlet, packet, whatever we call it. If you've been here before, you know that's what we do. The left-hand side is going to deal mostly with the medical plans that are available and go through some things on that. Then we're going to move to the right-hand side, and another individual will come up and talk about the Cigna products, and I'll say some things before that. We appreciate the opportunity to stay on as a broker for OTC and did a thorough job of marketing some coverage this year to get better pricing for you that we'll talk about here in a little bit on the dental and some of the ancillary. So now I'd like to introduce Maylene Smith from Cox Health Plans, and she's going to go over the plans with you and various things.
Thank you, Gordon. Good morning, everybody. What we'll do this morning is kind of the same format as what we've done in past years. So I will review the benefits for your plan options for 2018, and then just a couple of refreshers on information that we feel like is important for you to take away with you to get the best out of your plan for the coming year. The first thing I will mention is that in the past you have had 3 plan options available to you: the base plan, the copay plan, and the high deductible health plan, or HSA. That is going to be changing for 2018. The base plan and the HSA plan will be the options available to you. So those are the ones that I will be reviewing this morning. Starting with the base plan, the benefits on this option are not changing, so this should look fairly familiar to you. It has a $1,000 calendar year deductible for the individual, and then a $2,000 deductible maximum for anyone with family coverage. Now, those are the amounts that you would pay in for your health care services each year before the insurance company would start to share in any of the costs with you. So if you got to that point, then the cost sharing split would be 80-20. So the health plan would pick up 80% of your remaining expenses, and you would pick up 20% until your 20% were to equal an additional $2,000 for an individual, for a maximum of $3,000 out of pocket, or $6,000 for a family would be your maximum. Okay, so that's the same as it has been in previous years. Now, as we go through the spreadsheet here, on this plan for your physician visits, whether it's a primary care physician or a specialist, inpatient, outpatient hospitalization, those types of things all apply to your deductible. If you've met your deductible, you would pay your 20%. The copays on this plan are applied to the urgent care, emergency room, and prescription medications. So the urgent care copay is $100, and that will cover whatever is done in the urgent care facility. The emergency room copay is $200, and this covers whatever's done in the ER. But as you'll notice, that is the one benefit where the copay applies if you go in-network or out-of-network for your care. So there is an emergency provision under your plan that protects you in those instances where the closest emergency room happens to be out-of-network, or you had no choice in where you were taken to the emergency room and you ended up at an out-of-network facility. You would still have that in-network $200 copay benefit. In these circumstances, though, when you do have a choice of where you seek care, we're just asking that if you can go in network, that you do so, because that does help control the cost to the plan and to OTC overall, even though you're not going to notice a difference in your copay. The prescription drug benefit has a $100 prescription drug deductible. That's per person and resets every January, just like everything else. So essentially all that means is you're going to pay the first $100 of your prescriptions each year before your copay benefits would start to apply. So once that $100 deductible's been met, then your relative copays, depending on the type of medication that you're taking, would start to apply at 10, 30, 50, or 100. Okay? Now, all of these items that I'm talking about, your deductible, your coinsurance, or that 20%, the medical copays I mentioned, your prescription deductible, and your prescription copays all count towards your maximum out-of-pocket each year. So as you pay in on those items, they do accumulate towards your maximum out-of-pocket. All right. Now, as with last year on this plan, your cost would be, for your premiums, would be $0 per month as long as you participate in the wellness initiative and complete 2 healthy living activities as outlined by Human Resources, because they will be contributing $50 to the monthly premium incentive for you. Okay, so that is how you would accomplish $0 premium on this particular plan. Now, the high deductible health plan, or what some of you may call it as the HSA plan, is changing slightly this coming year due to the changes in IRS limitations. So they actually regulate the structure of the HSA health plans in that they have minimum deductible amounts, maximum out-of-pockets, and things like that, and they regulate the design of the plan. So this year, the minimum deductible for HSA plans was $1,300. They have raised that minimum to $1,350 next year. So in order for us to offer you a plan that is compliant and qualified to be paired with a health savings account, we must modify the benefit to be consistent with that minimum for 2018. So that is adjusting to $1,350 for an individual. And then the cost sharing split is the same as with your PPO plan. If you meet your deductible, we start cost sharing with you at that 80-20 split. And then you would pay 20% until your total maximum were to meet the $4,650 maximum out of pocket for next year. Okay. Now, as you will recall, in past meetings, we've kind of talked about how the deductible works on this plan, because it is not the same as the PPOs. This is considered to be a non-embedded deductible plan. What that means is nothing if you are just an individual, single person covered under the HSA plan. But if you have family coverage, and family coverage for an HSA is defined as you and one other person at minimum, so it could be you, your spouse, you and a child, or you and your full family, then the plan works such that the family deductible must be met in full, either by one or a cumulative of the members on the family, before the insurance company would start to share in any of the costs of your expenses. Okay? So that is different than the other plan. On the other plan, if you meet the individual deductible, we start cost sharing with you at that point on your services that you're incurring. So it is something to make sure that you understand before you enroll in this particular option, so that you understand how that's going to work throughout the year. As you go down the spreadsheet here, you'll notice everything applies to deductible and coinsurance. And that is another standard of HSA plans under IRS regulations. You cannot have any upfront out-of-pocket benefits. So everything does apply to the deductible first, and then your 20%. So that's going to include your prescriptions, which is something that you would, if you haven't been on something like this before, that it would take some getting used to, because you'd be paying the contracted rate for your prescription at the pharmacy instead of a copay. Okay? Now, the benefit of this plan, though, is that OTC does contribute to the health savings account on your behalf. They have done so for several years now, and that is increasing to $91 a month in 2018. You also have the ability to contribute to the HSA, the idea being that you're building a savings to help pay for your medical expenses on the plan if and when you have to use it. I had a gentleman come talk to me the last session who has saved what OTC has contributed and contributed himself to where he has actually more than the $46.50 in his savings account now. So he hasn't had any to use the plan, but when he does, he has more than enough to cover what his expenses would be. And that's the whole idea of having an HSA in place. Now, on this particular plan, you also have the premium incentive related to the wellness program initiatives. So you would receive the $50 monthly premium incentive as long as you complete the 2 healthy living activities defined by Human Resources, and that would put your payroll deduction at 0 for single coverage on this plan. Okay, so I'm going to delve into a little bit of Q&A related specifically to the health savings accounts themselves, just to give you a refresher, or if you haven't been on this plan and you're considering it, these are some things that you would want to know. So how are you eligible for a health savings account? So one of the key things is you have to be enrolled on a high deductible health plan, excuse me, and it has to be qualified under the IRS, which yours is, that we offer to you right now. You cannot be eligible for Medicare, and you cannot be eligible to be claimed on someone else's tax return. As far as putting money into the HSA, I've already kind of mentioned, yes, you can contribute to the HSA as well as your employer. Your contribution limits for 2018, again, as stipulated by the IRS, is going to be $3,450 for single coverage or $6,900 for family coverage. When you are using the money from the HSA account, you've got to make sure that you are using it for what the IRS deems as qualified medical expenses. So they do have those lists of things on their website, and it's pretty comprehensive, but you do want to make sure that you refer to it. You can use that money for other things, but if you do, you will get penalized under the IRS for 20% of your funds for doing so. So they're just wanting to make sure that you're using the money for the purpose that it was intended for, because you're taking that money out of your check pre-tax. Okay, as far as long-term use of the HSA, that account, it's a savings account just like any other, so it's your account with your lending institution, but the difference is you just have to use the money very specifically for certain things. So you can continue to use the money in that account until it's gone, okay? The main thing is you cannot contribute to the HSA unless you are enrolled on a high deductible health plan. So let's say 1 year you decide you want to switch back to the PPO. You can do that, but you couldn't contribute to your health savings account anymore. You would just have to spend that money down until it's gone out of the account. And then another question people ask is, can you have both the flexible spending account and the health savings account? And the answer to that is no. Under OTC's cafeteria plan, you cannot do both of those. Typically, you are going to have the flex plan with the PPO and the HSA with the high deductible health plan. Again, we always recommend that you talk to your tax professional or banking representative to make sure you understand the rules around having an HSA account. I just update these links each year for you in case you want to refer to them to get the specifics about the rules and also the list of qualified expenses. Just a quick refresher again, key points on both of the plans. Your deductibles accumulate on a calendar year basis, and you've always got to meet your deductible first before we start to share any of the costs with you, unless there's a copay benefit. Your out-of-pocket maximum also accumulates on a calendar year basis, and I already talked about what all goes into your out-of-pocket. You do have the benefit of going out-of-network if you wish to do so. Just if you do, you're going to pay more out-of-pocket, so just be aware of that. Generic versus brand name prescriptions, we touch on this every year. For those of you who are kind of squeamish about, well, my doctor wrote a prescription for a brand name drug, that's really what I should be getting. And that's not always the case. A majority of the time, the generic is going to be just as effective. They have to have at least 85% of the brand name content in the generic medication. Just know that when you go to the pharmacy, the plan is structured so that if there is a generic available for the brand name medication, the pharmacy is going to fill the generic unless you specifically ask for the brand or the physician has written dispense as written. In those cases, you'll pay the brand name copay plus the difference in the cost between the two medications. If you are on the high deductible health plan, one point to note is that the Envision RX does have a mobile app to help you price shop for your medications and find the place that's going to have the lowest cost for your prescription. Preventive services, quick reminder, this hasn't changed since 2010. You have the list of services available at no cost under the Affordable Care Act. If you have other services done that are preventive that are not part of that list, they'll be covered, but they'll process like any other claim. So in those instances, you might have some out-of-pocket expense. Provider network, that's staying the same as well, other than any individual contracts that might change. So we just want to remind you to always check, whether it's Cox Health Plans or if you're traveling and you need to see First Health, make sure that the provider that you're seeing is part of the appropriate network to make sure you're getting your in-network benefits. And then lastly, Direct Connect, our telemedicine benefit, that's still available to you. You can use your smartphone, any kind of smart device, and laptop, desktop, as long as it's got internet connection and a camera so that you can actually have the service, because it's just like Skyping with a provider. It'll be a $45 cost that will apply to your deductible. If you've met your deductible, then that would apply to your 20%. Extended office hours, definitely a convenience for all of you if you opt to use that. And they can call in prescriptions if you need it. Okay. I will turn this over to Gordon.
Any questions? Done a good job. Any questions on anything there? Okay. We'll be back there after we get done too. On the right-hand side of the packet, we're going to deal primarily with the Cigna coverages, and Scarlett's coming up from Cigna to go over those. They're essentially like they have always been. Those of you who take vision care, your premiums do not increase, and we actually got a decrease on the dental. And then, of course, the life, base life, and the LTD, the college pays for you. But we want to make sure you understand the benefits and the voluntary life options to purchase there and everything. So I'll turn it over to Scarlett. Oh, one last thing. I need to do this here. I forgot earlier. Back at the back, some of you have coverage on a child only or on a spouse only, or some of you are getting close to that magic 65 age. And Charlene's back there, table in front where our banner is, and she's here to help you with any individual insurance requests you have. You hear a lot of things about that, so we do have folks here, and she may just be able to get your information and get back to you, but I want you to be aware of that because a couple of people asked after the meeting this morning. Okay? Thank you.
Thanks, Gordon. Well, good morning, everyone, and thank you so much again for having us out this year to speak with you. It really is a pleasure and a privilege to get to speak with you and to have your benefits for 2018 again. So we're going to talk about your ancillary coverages. Those are your life AD&D and your long-term disability coverage with Cigna, as well as your dental and vision. And just as an overview, as Gordon mentioned, there are no changes to your plans. You're very fortunate that OTC does cover for you and pay the premium for your base life AD&D and then your long-term disability coverage. The long-term disability, you can kind of think of that as income replacement. So if you are unable to work, then long-term disability does kick in for you. And then you do have a basic life coverage that's provided to you by OTC. You also have the option to purchase voluntary life insurance. And voluntary life insurance, again, is it depends on if you want the coverage or not. And then during this annual enrollment period for the employee, you can increase your coverage by $10,000 with no evidence of insurability. Any increase for your spouse would require that medical evidence. And listed on the slide there are the benefits and how that breaks down for each of the coverages, your spouse and then your children. For the dental plan, now you have really, really rich benefits. Probably in all my clients, you have the richest benefits of any of my dental clients. So again, it's a pleasure to speak with you. For this plan, it actually incentivizes you to receive your preventive care. So as with the medical coverage, dental coverage as well, preventive care is very important. When you go to the dentist and get your annual cleanings, those examinations, they can find and detect things early so that hopefully it doesn't lead to more expensive procedures down the road. So your benefits for dental are not subject to a deductible, which is, again, unheard of. Your preventive care, your cleanings, your routine x-rays, those are covered at 100%. Now, the nice thing about this plan is, as I mentioned, it's an incentive plan. So the first year that you came on or come on to Cigna Dental, your benefit limit or your maximum that Cigna will pay is $1,000. And then as long as you get at least one preventive service during that year, then the next year, your benefit increases by $250. So it really is in your control as to how much benefit you will have. This year, you're currently in your third year, so if anybody's been covered that long and has received their preventive services, then you should be in this year at the $1,500 level. So your Class 1 expenses, again, they are covered at 100%, and you have a pretty extensive list on those things that are covered. Your Class 2 expenses, things like fillings, your oral surgery, again, that is covered at 100%, and there is no deductible. If you need major services, things like a crown or a bridge, then you do have a cost share. The plan will pay 60%, and your responsibility will be 40%. But again, there is no deductible. So again, just very, very rich benefits. So I encourage you to make sure you get your preventive care so that if you do have something come up in that major category, then you can build up and have additional benefit out there to cover those benefits. Talked about preventive care. Again, just keep in mind it is very important and it doesn't cost you a dime. So make sure you schedule those preventive visits and take advantage of that increased maximum then that following year. And your dental network is not changing either. It's the Cigna DPPO network. How many of you have registered for mycigna.com? Well, just a few of you. So that'll be your assignment today. You guys are giving out assignments, so I'm going to give you an assignment. We also have the MyCigna mobile app, which is a free app. You just download to your smartphone, and you have access to everything that you could do in front of your computer right from your mobile phone. So I encourage you to do that as well. Next, we're going to look at your vision benefits. And again, you have very rich vision benefits. You have an eye exam every 12 months for a $10 copayment. And then if you need hardware, lenses, frames, contacts, you also have coverage for that as well. You have a $25 materials copayment. And then once you pay that copay, your lenses are covered at 100%. You have coverage for frames, and there is a $120 allowance. If you would pick a frame that's higher than that, of course, you would get a discount on anything above that allowance. You also can get your lenses every 12 months, and then your frames are allowable every 24 months. So with that benefit structure, you could have glasses 1 year, and then contacts the next year, and use your lens benefit every year. Contacts are also covered up to that $120 allowance. We do use a subset of the VSP network. So out on mycigna.com, there is a link to the Cigna Vision directory. Any questions for me before I turn it over to Stacy? All right, thank you.
Thank you, Scarlett. Our next presentation will be Megan Bromer with MedPay. She will be going over our flexible spending for the 2018 calendar year. Thank you very much. With a flexible spending account, you're able to take money out of your paycheck before the taxes are calculated. And in doing that, it actually makes your paycheck go farther because what you take out, you don't pay taxes on it. And then you're able to use that money to pay for healthcare-related expenses throughout the year. There are some examples listed here: medical, dental, which does include orthodontics, vision, prescription drugs, chiropractor services, vision services, over-the-counter medications, but you will need a prescription from your doctor to keep on file in order to get that reimbursed. Also, over-the-counter supplies, which is anything like your inserts for your shoes, a brace for your wrist or elbow, Band-Aids, even contact solution. Those are all eligible expenses. Mileage is eligible for reimbursement. I don't know what the new rate is for next year, somewhere around 20 cents a mile, give or take a few cents. And that is for you to file that you could use miles to go to the pharmacy, to go to the doctor. It is very good when you have to go out of area, say for a specialist, that you do a lot of miles for that visit, that you can use your flex dollars to reimburse yourself for that as well. The maximum you have available is $2,650. This is a $50 increase over last year. The money that you set aside is available to you from the first day of the plan year, so it does help you plan for what expenses you're going to have for the year, and you're able to make sure and get that paid for when you need to pay for the service. You spend the rest of the year making up the money that goes into your account, so it's kind of like taking an advance on your paycheck for yourself. There's a second bucket that's available, and that's for dependent care assistance. This is for dependent children up through age 12 or your adult dependents you file on your taxes that may need daycare so that you're able to work or go to school. The max for that is $5,000. If you do share custody for children in a divorce situation, the max each of you could do is the $2,500 unless you make other arrangements between the two of you, but the $5,000 is the max total. This bucket of money is only available as you put it into the account. So you want to make sure and have all of your claims filed so when that paycheck gets cut, it's ready to do the reimbursement to you. There are a couple of ways that you can get the reimbursement. The first is if you pay for a service or an item out of your regular checking account, file the claim to us and we can give you reimbursement out of the account. That could be in a form of a check, or you can set up direct deposit. The other way is to actually use the Flex debit card. Our current card is a red card. When you have to order a new one in case you lose it, or if you want to order additional cards, the new ones that will be coming out will be blue. And also, effective in about February at the latest, if you need to order a card, you can get it in your dependent's name. So if you have a child at college or a spouse and you want them to have access to your Flex account, you can get that card for them. There are no fees for ordering a new card and getting a card in a dependent's name. And we are there to help you if you do lose your card and we need to change the number and issue a new card. Just give us a call and we can help you out with that. To order the dependent name card, we will have to do that for you. And again, it may be about February that that's available when our enhanced software is rolled out. When you use the debit card, we will try to substantiate the transaction for you and not have to ask for any receipts. But there are some ways that the IRS says that if it doesn't match, we're going to have to ask. So we'll send out those by letter or email. So if you have your email on file with us, just watch for that to come, and it will tell you the merchant where you swipe the card, the dollar amount, and the date of service. And you can just fax that back to us. You could use that letter as the cover sheet. You can also go online and upload a picture of it. And effective with the rollout in February, we'll have a mobile app, and you can actually do all of that from your phone. So watch for that. That's an exciting change for us. Some important dates for you to know. You have to complete your enrollment online. Flex is not an automatic re-enrollment, so you can go and calculate how much you think you're going to spend for the year and sign up for that as your annual amount. It'll divide across all of your paychecks for the year. If you have any remaining money left in your 2017 account, all of the services have to be incurred during this calendar year, but you have until March 31st of next year to get the claims turned in for reimbursement. If you do terminate employment, you have 90 days from the date of termination to make sure everything is submitted, but all of the dates have to be incurred prior to the date that you term employment. If you do qualify to do COBRA, which typically means you have more money left in the account that you've deposited than what you've spent, then you can continue to make those contributions post-tax, handle it later when you file your taxes, but then you still have access to the full amount of money in your account. And as I mentioned about the amount that you elect, it is not changeable unless you have a qualifying event. So marriage, birth, divorce, anything that changes the number of dependents, their eligibility under the plan, or say a spouse has a new job and there's the new eligibility and you're wanting to change your coverage to their plan, so it decreases or adds to your number of dependents, you may be able to make a change to your election amount. Some contact information, this is in your packet, so if you need to call us or you want to look online and check your account, the current website, hrbenefitsdirect.com/med-pay. When the new system's rolled out, you will have an automatic redirect done for you on the web, and it'll take you to a new domain that will have in there LH1 on demand. So just when you see it happen, know that's okay. I talked about the new portal will be up, the mobile app, and the debit cards are the 3 changes. You have a flyer in your packet about that. And if you do need to call and talk to anyone in our office to help out with questions about Flex, answer more questions for open enrollment, check your balance, anything if you're having trouble online, the phone number, the 841-4134 is our phone number. We are here in Springfield. Just give us a call. The email addresses at the bottom are there to help. If you need to file a claim, you can always use the claim form, fax it to us, email it to us, mail it to us, even upload it, or drop it by our office. Does anybody have any questions? All right, thank you very much. I'll be in the back of the room if you do think of one and want to catch me later.
Thanks, Megan. Our next presentation will be with our AFLAC representative, Amy Bursthorst.
I'm Amy with AFLAC. Craig is at the back of the room, so if you have questions, whenever we finish up today, definitely please stop by and visit with us. Most of you all know AFLAC supplemental insurance pays money directly to you. Everybody knows the duck. With AFLAC, you pick and choose what you want to do. We offer several different plans here at OTC. We offer an accident plan, a cancer plan, short-term disability, and a hospital plan. Personally, I have an accident plan. Can't hear back there. I have an accident plan. I have a 10-year-old. I have a 2-year-old. My husband does construction. I'm on the road all the time. I think it's a smart plan for me to have. I have a cancer plan. I lost my mom to cancer. My dad's had 2 different types of cancer. Unfortunately, I've got a pretty good family history of it. Short-term disability is going to be your paycheck if you're not able to work. So you pick and choose what works best for you, what you think fits your needs the best. We file all your claims for you, so something happens, you go to the hospital, you go to the doctor, we're going to take it from there, we're going to help you get your claims filed, and then AFLAC's going to send you the money. You do with that money whatever you choose you want to do with it. Put it towards your bills, put it towards your deductible, cash it, and go have fun. It's your money to use as you choose. Okay? We've got brochures, we've got rate sheets in the back of the room, and we're happy to answer any questions you may have.
All right, thank you, Amy. Last year, we offered a New York Life Whole Life Plan to all full-time employees. It had a one-time open enrollment, so if you didn't take advantage of it last year, you won't have the opportunity this year. Anyone that has started after August 1st, 2016 will now have an open enrollment time for that. Or if you did take out the New York Life Plan last year, you can talk with Jason in the back, and he'll answer any questions you have about your plans. Some last minute important things. The benefit portal will open today at noon. So you will have from noon today till 5 p.m. on November 27th to do your open enrollments. If you do not go out to the portal to do your open enrollment, then you will be closed out and you will have to come to HR and talk with me directly. So to go to the portal, you will need to log into your My OTC. On the left-hand side, you will select the little $sign, benefit enrollment, click on that. At the top of the page, it will show everything that you're currently enrolled in. This is the time of year that we like for you to review your dependents. Make sure date of birth is correct, social security number is correct, addresses are correct. Also, it's a perfect opportunity to check your beneficiaries. If you had a change in beneficiaries or circumstance, you can check it here. You can update beneficiaries anytime throughout the year by contacting me directly or emailing benefits@OTC. The next thing that we'd like to remind everyone is the Wellness Initiative. Again, if you can do your 2 healthy activities before December 31st, 2017, you will not be charged that $50 wellness. However, if you do not complete your 2 healthy activities by December 31st, on your January check, you will notice a $50 deduction for the health wellness. The healthy activities are either an HRA, offered through Cox Health Plans, or a physical. The physical can be done by our clinic, or it can be done by your private physician. The only thing that you have to turn into HR is a letter from the doctor that states your name, date of service, and type of service. We don't want test results. We don't need any of that. So just name, date of service, type of service, and signed by the doctor or the nurse practitioner or whoever handles the letters in the office. The second activity is be a non-nicotine user, or if you are a nicotine user, go through the online workshop through the Cox Wellness. Again, everything is due into our office by December 31st, or all services need to be done by December 31st. If we come back in January, you had everything done while we were on Christmas break, just make sure you bring me the letter. Questions? Yes? Yes. Right now, those are our 2 primary concerns. We're trying to get everyone to go for their physicals. Be aware of those chronic conditions. Right now, that's what they have chosen, is the wellness or the physical or HRA, and then the non-nicotine. Other questions? You can contact me. I have a checkoff list of everyone that's turned in their stuff so far. Any other questions? All right. Well, this is all we have for the open enrollment. We do have our vendors in the back. Please stop by and talk with the vendors, and they're happy to answer any questions.